Friends, here I am going to present a comparative analysis between volatile anesthetics, starting from halothane, isoflurane, sevoflurane, desflurane, nitrous oxide, and xenon. Molecular weight comparison: halothane is 200, 185, 200, 170. So halothane, isoflurane, sevoflurane, desflurane, they have more than 150 molecular weight, and the nitrous oxide is only having 45 and xenon is 130. So lowest molecular weight is of nitrous oxide, highest molecular weight is of halothane and sevoflurane. When consider boiling point, 50 degrees Celsius, 50 degrees Celsius, halothane 50 degrees Celsius, isoflurane 50 degrees Celsius, sevoflurane 60 degrees Celsius, desflurane is 25 less than 25 degrees Celsius in desflurane, and nitrous oxide 90 and xenon 110 degrees Celsius. So highest boiling point is of xenon and nitrous oxide, and desflurane has lowest boiling point. The lowest boiling point of desflurane has important significance, which I will discuss later on. And blood gas partition coefficient versus oil gas partition coefficient. Halothane has 2.5, blood gas partition coefficient 2.5, and oil gas partition coefficient 225. And that's why it is very slow acting drug, slow induction drug, but very highly potent, because it has a very high oil gas partition coefficient. So it's a lipid soluble, so acts rapidly, but it's a 2.5, so highly blood soluble, so that's why it takes time. Isoflurane also similar action, 1.500. Sevoflurane blood gas partition coefficient 0.75, oil gas partition coefficient 80. Desflurane has blood gas partition coefficient 0.545, oil gas partition coefficient 30. Similarly, nitrous oxide 0.045 and 1.5, 0.15. Xenon has 0.15 and 2.0. So blood gas partition coefficient is halothane 2.5, isoflurane 1.5, sevoflurane 0.75. Next, desflurane 0.45, nitrous oxide 0.45, and xenon 0.15. I have made it slightly easy to remember. And for oil gas partition coefficient 225, 100, 225 for halothane, isoflurane 100, sevoflurane 80, and desflurane 30, nitrous oxide 1.5, and xenon 2.0. Now MAC value comparison. Halothane has 0.75 MAC value, lowest MAC value, so that's why it's a very high potent drug. And isoflurane 1.15, slightly higher than halothane, but it is also very potent drug. Sevoflurane 1.8, desflurane 6.6, nitrous oxide 105, and xenon 70. So 105 is the highest MAC value, and that's why it is very weak anesthetic. And saturated vapor pressure at 20 degrees Celsius in kilopascal. The halothane is 33, isoflurane 33, sevoflurane 22, desflurane 88 kilopascal. When it is converted into mmHg, it's 668 mmHg. And nitrous oxide is very high. Saturated vapor pressure is 5000, more than 5000. Odor: halothane is a non-irritant drug. Isoflurane is irritant, sevoflurane is non-irritant. So halothane and sevoflurane, they are non-irritant gases. That's why they are used in pediatrics. Desflurane is also irritant, and nitrous and xenon are odorless. Onset and recovery: halothane is slow onset and offset. Isoflurane is a moderate speed of offset and onset. So it is and sevoflurane have rapid onset offset. Desflurane is very rapid onset offset. Similarly, nitrous oxide and xenon. Metabolism in liver: halothane is 20% metabolized in liver, and isoflurane is less than 1%, sevoflurane 2.5%, and desflurane is a negligible metabolism in the liver. Sevoflurane cardiovascular impact: heart rate, contractility, systemic vascular resistance, and blood pressure. So halothane suppresses the cardiovascular system. You can remember by this. Halothane suppresses the cardiovascular system, decreases heart rate, contractility, SVR and BP. On the other hand, isoflurane, except the heart rate, suppresses the other things. So isoflurane increases the heart rate, causes tachycardia, but suppresses the other things like contractility, blood pressure and SVR. Similarly, in sevoflurane, it has no impact on the heart rate, but it decreases somewhat the SVR, BP and contractility. And desflurane also causes tachycardia and suppresses other things. And nitrous oxide have no impact on the heart rate, SVR or BP, but it decreases the contractility. And xenon has minimal effect. So xenon is very cardiovascular stable drug. Respiratory impact, tidal volume is decreased by each drug, and respiratory rate is increased by each drug, and bronchodilation effect, halothane, isoflurane, sevoflurane, all these three drugs have a bronchodilation effect. Desflurane is irritant, it can cause laryngospasm. Now the neurological system impact, halothane on the cerebral blood flow, cerebral metabolic rate of oxygen consumption and EEG burst suppression. So in halothane there is a increased cerebral metabolic blood flow and decreased cerebral metabolic rate of oxygen consumption, and EEG has a blood burst suppression, and somewhat similar effect seen in isoflurane, but in a low potent level. And sevoflurane also decreases the CMRO2, a similar effect in other drugs also. Mode of action is on the GABA A receptor, halothane, isoflurane, sevoflurane and desflurane on the GABA A, and nitrous oxide and xenon on NMDA. Muscle relaxation, halothane provides some muscle relaxation, isoflurane, sevo and desflurane significant muscle relaxation, not on the nitrous and xenon. Toxicity, hepatotoxicity seen in halothane, trifluoroacetic acid, so it has chances of fulminant hepatitis. Isoflurane has minimal toxicity. Sevoflurane is compound A, renal toxicity. It is a rare phenomena, but it has formation of compound A, which can cause renal toxicity. And nitrous oxide, diffusion hypoxia. On prolonged contact, it can cause other things like vitamin B12 deficiency, bone marrow suppression, megaloblastic anemia, greenhouse gases, it can cause pollution. More than 50 ppm in the OT, it can cause pollution in the OT. Special points, halothane is non-pungent, non-irritant, so it's good for mask induction in pediatrics. Slow onset, hepatotoxic because of trifluoroacetic acid. It can cause cardiovascular suppression, it can cause hypotension, arrhythmia. Fulminant hepatitis is seen, less used nowadays because of multitude of side effects, and slow onset and slow offset. Whereas in isoflurane is good drug, it is routinely used. Halaki, it is an old drug, but it is used nowadays commonly. Moderately irritant, less than the DES. Still can be used airway irritant. It can cause airway irritation at high doses. Side effect at high dose, decreases blood pressure, respiratory depression. It is an older agent, cost effective, reliable, but there are slight side effect of cardiovascular suppression and respiratory suppression. Coronary still phenomena is seen because it causes vasodilation of the coronaries. So in the ischemic areas, blood flow is reduced. Already compromised areas will get lesser and lesser blood in the coronary still phenomena. It is seen in isoflurane. It can decrease ICP and provide better cerebral perfusion pressure. So it is good for neurological surgeries also. And sevoflurane is very safe, minimal airway irritation, ideal for pediatrics, mask induction in children. mild cerebral protection, mild vasodilation of cerebral vessels, minimal increase in ICP, preferred in neurological surgery. So it is preferred in neurological surgeries. In desflurane, highly pungent, airway irritation, it can cause bronchospasm, not ideal for mask induction, strong bronchodilator, tachycardia, hypertension, expensive, it requires special vaporizer, Tech 6 in the, because it has low boiling point. So it is kept pressurized at 2 atmosphere at 39 degrees Celsius in a special vaporizer, that is Tech 6. So electrically heated, it is electrically heated vaporizer. Nitrous oxide, very rapid onset, concentration effect, second gas effect, diffusion, hypoxia is possible during extubation. It can cause nausea, vomiting, vitamin B12 deficiency, because nitrous oxide acts on cobalt, and cobalt is part of vitamin B12. So it impacts malonic acid or malonate, and malonate has important participant in the synthesis of DNA. So it can hamper the DNA formation. Megaloblastic anemia might be the result, and bone marrow suppression. Xenon is very good drug. It has almost no side effects, and it is very cardiovascular stable drug. The only problem is that it is very costly, and it is usually used for research purpose. Thank you.